Hi, I'm Dr. Morgan. I'm a family nurse practitioner. Welcome to Health Talk. Today I'll be talking to my dear colleague, Levete. She's a registered nurse and she's going to tell us a little bit about herself in a minute. Today we'll be talking about fertility issues or otherwise infertility. So Levete, welcome to Health Talk. Tell me about yourself.
Hi, Cheryl. Hi, everyone. My name is Levete Wallace. Of course, as she said, I'm a registered nurse. I'm also a registered midwife. I've been an emergency nurse for over 20 years. A new mom of two lovely sons, Isaac and Joshua. Isaac is 2 years old. Joshua is 1 year old. I have a very awesome husband, Isaac, who's very supportive, and they've led me to write a book about my fertility journey, which took me approximately 20 years.
Wow. So Levete, tell me, how long have you been married and how long have you been, first of all, when did you realize that you might have a fertility issue? Because, you get in a relationship or you get married and you're thinking that pregnancy is going to happen within 6 months to a year and it didn't happen. So when did you actually acknowledge that there might be an issue?
Well, as you said, you get married. So we dated, are very optimistic. You're unaware of possibilities of any fertility challenges. So going through our relationship, after about a year, we're like, okay, hopefully next year, 2 years. Okay, we hope for next year, 3 years. Okay, something not seeming so right. Being a nurse, you have some knowledge, and one of the knowledge that you have is that after a year of trying without any contraception, if fertilization doesn't occur, then it's time to seek medical help. Well, we didn't think too much of it, so we just continued to live our lives, enjoy each other, and hope for the best. Then when I think when I was 25, yes, at 25, I got pregnant. Oh my goodness, we were over the moon. We were super, super elated. But unfortunately, after I was probably about 8 weeks along, I had a miscarriage.
Okay, I'm sorry to hear about that. A lot of women think that because they're having their menstrual cycle that they are able to get pregnant. A lot of the menstrual cycles are called an ovulatory period. And I'm not an OB person. My friend Nancy would be the perfect person to talk about that. But, from my training, I still do touch on a little bit of OB. So you realize that something was wrong. And from what I'm gathering, you've been married for 20 years and you got pregnant and have these babies like 20 years later.
Yes.
Okay.
When you speak about the anovulatory menstrual cycle, of course, going through my journey, that was one thing that was revealed to me, that for the years that I've been having a menstrual cycle, one of the things that clued me in that something was probably wrong was very irregular cycle. So your cycle would come every month, but you couldn't put like a 21 day or a 28 days figure to it. My doctor was pleased to inform me that all my menstrual cycle over the years were like anovulatory menstrual cycles.
Okay, so this is a key element that women need to understand. So any of you out there having a period, it's irregular, and you're trying to get pregnant, you might not be having like a real ovulatory period that you can get pregnant within, certain days of your cycle. And a lot of women don't even understand their cycle. They think that the cycle is when their period starts and the day when it ends. It's a whole 21 or 28 days based on, your pattern. Yeah. So when people talk about fertility treatment, they think it's a simple thing. I practice most of the time online, and I will get a patient come into my inbox and tell me that, can you prescribe this medication for me? I'm trying to get pregnant. And I explain to them that it doesn't work like that. I'm giving you this medication to stimulate your ovaries. What if your fallopian tubes are blocked? Fertility process, it is a whole different kettle of fish where you have to do certain testing to see the entire female structure down there to see if everything is fine, to look at your hormones to see if your hormones are, regulated. It could be issues like polycystic ovarian syndrome. It could be your ovaries not producing certain hormone. It could be your pituitary gland not stimulating the ovaries. It's a whole part of medicine, it's a whole branch of medicine that need to be evaluated. But because of the cost, a lot of people try to go the easy and the quick route. So if I give a lady a medication to stimulate the ovary and she says for instance, she got pregnant and there's other complications there, that could be bad for the lady. So I want you to walk me through the fertility process. When you walked in, what were your expectations? Did you think that, okay, I'm going to walk in here this month and next month I'm going to be pregnant? Share your journey.
That is so true. So, after going through the years, ended up turning out I had 3 miscarriages total. Then I started seeing this obstetric endocrinologist because in my younger years, I found out that I had hyperthyroidism. Of course, now getting close to 40, hopes are starting to grow dim. So I inquired about this obstetric endocrinologist, which that was kind of new to me because they're obstetrician, but you didn't know that they're specialists within specialists. So my doctor, he is a fertility doctor, but his branch of fertility management is to do with endocrine issues. And he works with a whole team that has other specialties that within the field of obstetrics. And so this doctor started seeing me, and with each visit, he found out I had some other challenges. One of the challenges he found I had a pituitary tumor. The pituitary tumor impacted my thyroid function, which my thyroid function in combination with pituitary affect my ability to conceive. And so he started me on a cocktail of medicines. With each visit, the cocktail of medicines, he had to be monitoring to make sure my hormone levels were in check, make sure that everything else was going okay. And then while checking for other things, because these doctors, they are very thorough. The fertility journey was very interesting. You think that you just walk in and the whole process is just done. First, he had to check me out medically. So we did a complete blood screening where he checked me for genetic conditions, any and every kind of abnormality, even those I've never heard of. Then he had to do a physical, which included taking me to surgery on 2 occasions because they had to check for polyps, fibroids, any possibility that could obstruct the baby being okay within the womb. And so that process ended up taking me to surgery twice. And then when that part was all done, I thought that was it. Well, no, hell no. Then the doctor had to put me on a cocktail of medicines to help me to hyperstimulate my ovaries to produce multiple eggs. I was very elated about this process. They gave you medicines, you got shots. As you went for evaluation every day, they checked to make sure the eggs were growing okay. Then almost like a chicken, I would say, when I got a certain number of days when they were okay, they satisfied that the eggs were mature enough, then I was scheduled for surgery for the retrieval of the mature eggs. Fortunate or unfortunate for me, they were able to retrieve 21 eggs from the whole hyperstimulation process. And it turns out, I was so happy, 21 eggs, no. Turns out when they did testing on all of those, they had to discard 19. So it turns out I only had 2 viable eggs, 2 viable eggs, yeah.
And here I was thinking that you were gonna have 21 babies.
Listen, some persons are lucky that all are okay. Some persons are unlucky that sometimes when doctor going 0 is okay. I was fortunate to have 2, so I count my blessings.
Yes, and the thing is that yes, you produce those eggs, but it's the quality of the eggs, and that's
Yes.
another thing that women don't know, that,
Yes.
oh, you're just producing, you just want to take this medication to produce these eggs. What about the quality of it? And one interesting thing is that I found out that whenever a woman has a miscarriage, most of the time there's a high birth defect in that fetus, and it literally aborted itself.
Yes. So in my book, I talk about the most common causes of miscarriage in the female. And of course, that's one of the number one causes. Baby is developing and the baby find out that it's going to be abnormal, it aborts itself, prevent everyone from all the trauma and drama. So while a miscarriage in itself is very disheartening, very discouraging, sometimes in the long run, if we should find out what was a real reason, we would be not so disheartened and discouraged.
Yes, I remember back in nursing school, they told us about a lady who had multiple miscarriages. And the very last one, she's like, I'm determined I'm going to have this child. And she went in, the term is called cervical cerclage, where they actually suture the cervix to prevent women who have incompetent cervix to carry a normal pregnancy. So when you have incompetent cervix, it starts opening before it's time for you to go into delivery, start thinning out. So they did that to her and put her on bed rest for almost 7 months. And she delivered a baby who had a lot of birth defect. So nature tried to take care of the body, even though a miscarriage is painful and it's a loss of a child, because a woman can grieve a miscarriage as if they had that child, because once you become pregnant, you are attached to the unknown that is in you. Your whole personality change, your emotion change, and you start having hopes and start imagining what the baby looks like. And then for the loss, it's devastating. I've never had one, but I can just imagine a woman going through that.
It is very devastating. And even with the hopes and the many great things that comes with IVF, it's also an unknown as well, because when the embryos are retrieved and they find the very good ones and they fertilize this egg outside of the womb, after it's implanted, no one knows what's going to be the outcome. The same risk and even higher risks that were associated with pregnancy before IVF becomes associated after you've conceived. And with IVF in itself comes a lot of complications, which women who are on IVF treatment have to be seen by a high-risk doctor for the fact that it comes with a lot of risks that you never thought were even possible. You could say, I'm healthy, I'm young, that cannot happen to me. One of the most severe risks associated with is preeclampsia. Preeclampsia is severe hypertension. The procedure of IVF predisposes a woman's risk to preeclampsia and eclampsia, which is the most severe form of preeclampsia. So, going in, it's a lot of unknown, and persons just have to pray and hope for the best. Just as if you have conceived normally, you have to pray and hope for the best with IVF.
So you can get pregnant, you can conceive, but is the body able to carry a viable pregnancy? Because there are some other hormones that take place, that take charge. So before you get pregnant, it was like progesterone and estrogen. Once you get pregnant, I'm just talking from memory here because I haven't read this in a while, but I know that the placenta start producing its HCG, and that hormone helps to maintain a viable pregnancy. And that is why when a woman is pregnant, you do the HCG level, and when they are having a miscarriage, you check that level to see if it's going up or if it's falling. So if your body, if your hormone, you have hormone imbalance, and everything is not flowing right, you can get pregnant, yes, but you might not be able to sustain that pregnancy.
And that's one of the things also with IVF, once you've started the treatment and doctors started to intervene, you're put on a regime of medicines to help you sustain and maintain the pregnancy. And of course, in my case, they did like blood work meticulously. Every 2 days, I had to be going into the doctor for blood work for them to make sure that medicine doses were correct and that I didn't need any additional medicines, different types of medicines that is, or any adjustment in the doses. And so it was a long, tedious process, but I can tell you the reward was very great.
Okay. We're going to talk about the cost of IVF and if that's something that you want to share. Is that something that you're comfortable in sharing?
Oh, sure. I am comfortable sharing because a lot of persons care about IVF, and in former days, you know that this procedure could only be afforded by the very well-to-do. Here in the US, in my experience, the doctor, they have options. The government apparently has some special loan that is offered if you want to do the IVF treatment, which comes at a particular interest rate, and then you can go, because with IVF, with each stage, the cost increased. So in my case, it was over $50,000 I had to find out of pocket, because fortunate for me, because I had medical condition, my insurance was agreed to cover some of the cost. However, the cost of the medications, which the medications can be quite pricey depending on what end of the spectrum you fall. The medications to help get you pregnant and help you stay pregnant, that can be where the bunch of the costs lie. And sometimes you have to take out a loan to do it if it is what that you really want to do. But I can tell you, it's worth it.
This is a very sensitive and a very emotional topics, because I have met patients who struggle with infertility. I've had a patient who, she's from African descent, and for people who understand the African culture, once you get pregnant, once you get married, they're expecting babies. And if a woman can't deliver, it's almost like you're barren, you know, you're no good. So she tried and she tried and she went through the IVF process, and one of the injections that she was taking increased her risk of DVT, and unfortunately, she ended up with a DVT.
Yes.
And she had to stop that medication, and she wasn't sure. When she went back to her doctor, they said, like, you're gonna have to stop taking the medication and she's gonna end up losing that pregnancy. So in the event that a woman develops certain complication and lose a pregnancy, is this considered the same treatment if she wants to continue with IVF, or is it a new treatment all over?
Unfortunately, it's a new treatment all over. With each attempt, with each effort, you have to pay for the whole process over, because what happens is that the medicines, they have to start you again from scratch. And so let me say this, there are the different phases, because if you are at the phase where they were able to retrieve viable eggs from you, sometimes women use donor eggs. If you were at the stage where they were able to retrieve donor eggs, then you have completed one aspect of the IVF journey. The other aspect is now to get the fertilized embryo into you and to maintain it for the 9 months that or for however long it's going to be there. And so in my case, I was fortunate to know to go past hurdle 1, which is for them to retrieve the viable eggs, and then go to hurdle 2, which is to get pregnant and stay pregnant. So the medications leading up to trying to get the viable eggs, that's expensive, but that's not so costly. When the cost starts to hit is when the part comes to maintain the pregnancy. In my case, I was on 2 shots, patch, pills, sublingual pills, and I felt like I was just a walking pharmacy. But for what the doctor explained is that in the first 3 months, the hormone level has to be perfectly right to maintain the pregnancy. And so this is what those medicines were doing, keeping my hormones level at where they needed to be so the pregnancy could be viable. After 3 months, then the placenta takes over the care of the baby. So the placenta starts harvesting nutrients from mommy. And so you don't need so much medicines. Also, the placenta starts producing its own hormones at 3 months or 12 weeks. And so you're able to come off of these medicines and allow the pregnancy to progress on its own. So in my case, I took medicines up until 3 months. After 3 months, The placenta took over. Doctor was comfortable that everything was okay. I was weaned off medicines. Medicine stopped, and the pregnancy progressed on its own because it's now literally smooth sailing on its own.
Okay, that's awesome. Now, something miraculously happened to you. After you went through all of that to have one baby, tell me what happened after you delivered that baby.
So in my case, because of my medical complication, my doctor didn't even think that I needed to be on contraception. So they sent me home and said, Levete, see you in a few years to get another baby via IVF. Well, when my baby was 6 months old, I found out I was pregnant again. This time via natural conception. Now this part blew their mind because I had to be on total 9 medicines for the first 3 months of my pregnancy. In this time, I was only taking medicine for my pituitary tumor, my thyroid, and just vitamins. They could not believe it. So doctor said, I'm not even going to touch you until you get to 3 months because you have to be someone from another planet. So they were kind of hands-off management. When I got to 3 months, I was like, hey, hello, doctor, here I am back. And then 9 months later, doctor's like, well, you are one for the record books. 9 months later, I had another son. So now I have 2 sons, and they're my joy, my hope, and everything.
This is this is an absolutely amazing story. It's almost like your fertility treatment literally reset your whole reproductive system.
It did.
That's amazing. So that you literally have 2 miracle kids, right?
I had 2 miracle kids. I said, I asked God for one, and then God said, here's a bonus just for you, my child.
So when these kids know there were 2 and 1?
Yes, they're 15 months apart.
Okay.
Yes, and so they're best of buddies. I said they team up against me sometimes.
That's what I'm gonna ask you. So when they start giving a little trouble, and how do you respond to that? Oh, let them stay. They're fine. My little miracle babies.
These boys, they are so into everything. You just have to start your disciplining from early. So all of this motherhood thing that I've been saving up over the years. Oh yes, now I have to make sure that I've learned. I'm applying it with all the love and care as I can, as early as I can.
So as a midwife, while you were going through this process, I know that it becomes a little bit crazy because you had so much knowledge, you know what to expect, you know about all of the complications of pregnancy.
That was the part, because the knowledge I had too much knowledge circulating around in my head. And persons always try to think of themselves as the best. So because of so much knowledge, I never thought myself to have so many complications along the way. And when they were highlighted to me, when the doctor did each blood test and whatever testing, and it came back and it was positive or abnormal, I was just like, when did that happen? So how was this happening? And then it was further explained to me stuff I did not know, that these things are possible and our body can still function like normal even with these things being abnormal.
Yes, it does. I have a friend who had problems conceiving and heavy periods. And when she investigated, she had a condition called adenomyosis, where it's like, I don't remember the name of that condition, where you have is that the uterus lining was on the outside of the uterus instead of on the inside. And the treatment for that was a hysterectomy, of course, and she didn't have kids. And
Wow.
She said, no, I'm not gonna do this. And she went and she started doing some research on her own, dig deep, and she eventually developed some herbs. And she took those herbs and she was able to conceive. The problem eventually went away, and she was able to conceive and have not just one, but several children. And as a result of that, she has her old herbalist business, and she's also, I don't remember the term that these ladies who actually help you deliver baby, they're not midwives, but they actually, coach you through the pregnancy and the delivery process. A doula.
Health coach, I think.
Like a doula. She's like a doula. So
Yes.
she does that. So, you know, there are several miracles in the world, and it all depends on your faith as well. Well, I know that a lot of women, you know, watching this right now, I know people personally who are on my Facebook and friends of mine who are struggling with fertility issues. This is a story that I want you to watch. I want you to support Levete's journey. I want you to support her book. She's going to put the link to her website here. And also, are you going to put the link to your medical professionals?
Oh, yes, the link is there on the website. There are sites that you can go to get direct help. Yes. Even the one where my doctor is at.
And I like what you said about the loan, because I never know about that.
Yes, they do offer loan help to help families. Yes.
Okay. So there you go, guys. This was Levete with all her complications in pregnancy, and now she has two beautiful boys. I'm going to share their picture on the Facebook when I'm done. Do you have anything to say in closing?
In closing, I just want to say, a person's going through fertility challenges, person's going through general challenges. You know, it's easy for others on the outside to say, just keep hope and have faith. But for Levete, I can tell you, keep hope and have faith, because one day your miracle is going to come.
Thank you so much for sharing your story. I really appreciate it. It takes a lot of courage for you to even write a book to publish about this, because a lot of times people are very private about their medical conditions and their struggles.
Yes, it's my pleasure to share, because I want to help at least one other person to, you know, feel the joy of motherhood.
Okay, thank you so much, Levete. This was Elle Talk with Dr. Morgan. Have a good day. Bye-bye.
Bye-bye.